what's awesome today in talking skin myths. So if it's not super clear, I think it will be really quickly, especially with our day and age here where we turn to the internet with all of our skin questions. Like so many people like research on the internet for any skin question, and there's a lot of nonsense passed around. So safe space here. This is not about condemning anyone for the way what you thought, or we're going to just jump in and clarify and provide the explanation behind that. So what's awesome in having Jan is that she's got over 30 years experience in this industry, both product formulator on every end. So there's really a clinical, factual, scientific basis to go off of and qualify these answers. We've got some great ones, and of course we'll take what we have in here. So I'm gonna add Jan. I just wanna introduce her. I've told you about Jan. She's been an industry icon for over 30 years, and by New Beauty Magazine was named one of the top 20 innovators in the aesthetic space. She's spoken at medical conferences, holds many patents. So we've got a lot of wealth of knowledge to draw off of here. So I'm very excited to our live, and then we'll just jump right in with your questions. So I introduced you, Jan. There you are. I'm so excited you're going today. How are you?
I'm good. Lisa, it's so good to see you. It's been a little while.
It's been a little while. It's a really busy season, weird for most people, but also really busy. So I'm excited we get to do this today. I think we have really good questions to start with, but this is going to be, I've been just stoked because this is fun information to cover. And
it is. Yeah.
Okay. So do you want to maybe even set it up? When we're talking skin myths, I kind of shared initially that I think this is so relevant because a lot of people, I find, when they have skin issues and therefore skin questions, they go to the internet and look up things. And I saw someone on Instagram this week saying I'm having acne issues and I am, asking all of you, my followers, what to do. And the information given, I was like, no. So the problem is there's a lot of misinformation. So do you want to maybe give your take on our skin myths?
Well, I'll tell you why it resonates with me is that the average woman has over $600 in product in her bathroom she doesn't use. Mm-hmm. And, we hear things and we're told all of these different supposedly factual pieces of information. And then we buy products based on that. And sometimes they're really expensive products. And I have to tell you, I always get asked by the media, what inspires me and why I do all the research and development. I give the same answer every time. I'm really selfish. I do it for me because I don't want adult acne. And I don't want rosacea, and I don't want discoloration, and I'd like to keep lines and wrinkles away as long as possible. And so I'm really about solutions, real solutions. If you're going to address a skin concern, I want individuals to have the knowledge to be able to address it in a way in which they're really going to get results.
Mm-hmm. Yeah. Okay. And I like that what we want to provide here is that factual basis. Of course, qualified your background and why I think we're so privileged to be able to do it in this way with your experience and knowledge. So let's jump into some questions. These are good questions. I'm like, how do we start with the best? Okay, so I'm going to start down the acne route because I get more acne questions than anything. So what about when people talk about, and they'll hear it from their derms sometimes, that the sun helps acne?
It doesn't. Okay, so why do we think that it helps acne? Well, I could get into a lot of technical detail, but essentially the acne process starts off with the way that your cells stick together in the follicle abnormally, and then it traps oil and it traps P. acne bacteria. And your follicles rupture and you end up with a lesion. Now, what happens when you have sun exposure is, number one, as it starts to tan the outside of the skin, which is a sign that your skin has been damaged, it also causes the skin to harden a bit. Mm-hmm. And when your skin hardens, it suppresses all of the acne processes in the follicle. So everything is still happening in there, but it's being suppressed by the fact that it doesn't get to the surface as easily. So what happens is while you're in the sun, you think, oh, my skin is better. And then, particularly with teenagers, when they go back to school in September and they're not sunbathing, then all of a sudden they're breaking out and they're thinking, oh my gosh, it's because I need to be out in the sun again. Plus, acne is an inflammatory disorder. The sun is our number one source of external inflammation.
Yeah.
And so not only are you aging the skin, but you're actually exacerbating the acne process, even if it wasn't suppressing the process in the follicle.
Yeah. And when I tell clients who they come in about acne, and when I tell them about a sunscreen, they're like, I came here for acne, not aging. And I'm like, well, the other part is, do you want to be left with marks because the lack of sun protection is going to worsen that potential?
Lisa, you just brought up a really, really good point. So a lot of people say, I need to address my acne scarring. Now, what they're really talking about most of the time is post-inflammatory hyperpigmentation. So an acne scar is an actual wounding or an injury to the dermis, to collagen. So the marks that you get left afterwards that can be reddish, they can be purplish, they can be brownish, blackish. That's post-inflammatory hyperpigmentation. And it can take a long time to go away. The sun can actually make it so much worse, and it can even trigger more of it.
Yeah.
So there's so many reasons. And here's the bottom line. If somebody is using the system and they're using Duality, in a very short period of time, you can get complete, total clearing. And the whole thing with acne is you want to prevent it. So there are ways that you don't have to ever break out. And I know, because I'm a 2-time Accutane failure, I never break out, even when I wear a mask all the time. So you can get complete, total clearing.
Yeah. Okay, so the question popped in on the feed here. What about blackheads? So this is totally different from an inflammatory type of acne, but we are dealing with oil and cell buildup. So how would the sun, I'm going to say, negatively impact blackheads?
Same thing. Blackheads, clogged follicles, are a mild form of acne. So when I ask people, people will say to me, oh, Jan, I don't have acne. I just, maybe I break out once in a while, but I don't have acne. It's the same process, whether you break out once a day, once a month, whether you break out every day, several times a day, or whether you have clogged follicles and blackheads. So when we address acne in general and get clearing, and I say complete, total clearing, we're actually able to virtually address all of those concerns. Yeah. And by the way, we can de-age the skin at the same time. So when I put people on Duality, even if they don't have acne, even if somebody didn't have acne, they could use Duality, and their skin would look younger and look better. And granted,
there's not one case represents all, but I do always refer to myself in that I'm an oily skin. I'm totally acne prone. I use Duality every day. But the interesting thing is I don't get a lot of blackheads because of how it's managed. So I still am oily acne prone, but and wearing that sunscreen. So those things kind of get managed simultaneously. And we would all like to stay really young. Okay, so let's go to also like well, I'm gonna shift a little bit here. I want to throw in a question that I get asked a lot. Taking collagen. This is at least weekly of, hey, does taking collagen help your skin? Will that help me look younger? And I know we talked a little bit, so there's a few ways to go with this, but could we explain how collagen, what I usually have to say, well, drinking collagen or taking it orally is not going to put collagen into your skin and just firm it, but I guess I'll just leave the question to you. How about taking collagen, Jan? Okay, so I don't know what product they're referring to, but if you're just taking collagen, it is not going to add collagen to your skin. Okay, it's not going to somehow thicken your dermis. There are certain products. One is a tablet called BioCell. Now, BioCell is not collagen. BioCell was actually pioneered in work in elderly arthritic patients because it is a type of hyaluronic acid that's attached to a peptide. And
what they did in the study was to determine whether or not by taking this, they could cushion joints and lessen some of the inflammation and swelling and make people easier to have mobility. And what they found in the study, anecdotally, is that people were saying, wow, it's like somebody gave my skin a moisturizer. My skin is plumper, it looks fuller, I have less brown spots. So we do have evidence there are certain oral types of substances that can actually improve the skin, but it's not going to be drinking a collagen supplement. And what I always tell people is look for some type of medical data, not just the data that, let's say, that somebody, it's an opinion of someone in the company or an opinion of someone who made the product, that peer-reviewed medical journal data, something that where other individuals have studied this and they have actual statistically significant data.
Yeah.
Now, by the way, there are things you can do to make your skin look younger internally. First of all, aging is an inflammatory disorder. That has absolutely been proven over and over again. Mm-hmm. And there's a lot of research going on right now by top researchers. This is not science fiction. And it has to do with what's called youth span. Mm-hmm. And what we have determined is that we don't need to age. We're going to die, but we don't need to age in the way that we think we need, that people age, with heart disease and Alzheimer's and all of the other opportunistic kinds of things, and lines and wrinkles. And one of the ways that it starts off is with diet, and there's other things. There's even an anti-aging drug that's going through the FDA right now. But you want as least inflammatory diet as possible. Now, what turns to inflammation? If you're having a lot of carbs. So it's not just sugar, but it could be carbs and virtually anything. So you limit carbs, you want a non-inflammatory diet, and there's all kinds of, I wish I have another topic on this. There's all kinds of.
I know. Okay, anti-inflammatory diet. I love that. Okay. Also, it kind of goes off of where you touched on this about kind of feeling moisturized from the inside. Whenever I talk to someone about a dehydrated skin, so I'll say the question first. Does drinking a lot of water plump the skin or hydrate your skin? And so whenever I say a dehydrated skin, people go, I know I should drink more water. I'm like, well, yes, but that's not exactly what I'm referring to. And so like water and drinking water can hydrate our skin enough.
Okay, so first of all, you have a certain percentage of water in your body. And depending on the individual, it's somewhere around like 50% to 63% or something. And when you drink a lot of water, what happens is you go to the bathroom more frequently because your body doesn't decide, oh, I'm going to keep 90% water, or I'm going to keep, 75% water. Now, what determines how nice and plump and juicy looking your skin is you have something called glycosaminoglycans, and they're made up of hyaluronic acid, mucopolysaccharides, ceramides, and phospholipids. And what they do is your stratum corneum should lay like shingles on a roof, really even, cohesive, great barrier function, should look nice and smooth and luminous. And in between them are these sort of like the glue, and it's these glycosaminoglycans. So as you age through sun exposure, diet, the aging process, you produce less of these. It's also, there's a kind of a trigger effect too with hormones as your hormones decrease. So what we do is we work with people to increase those substances in the skin. You do it through glycolic acid, you do it through retinoids, you do it through using, let's say, Hyla 3D, the system, and we can significantly increase those substances. And then your skin looks much plumper and much more moist and much more hydrated. Now, they've actually done study. They did a study with twin girls. One twin they both used the same skincare system, and one twin went around drinking water all the time, and the other twin just had normal amounts of water in the diet and whatever. And what they found out is that the twin that was drinking all the water was no more hydrated in terms of skin hydration than the twin not drinking the water.
Yeah.
Now, if you're truly dehydrated, you need to drink normal amounts of water, but it's not necessarily going to have a direct effect in that your skin is somehow going to transform.
Yeah. And I would also add that so much has in our environment is topical, so it does not replace skincare. But like if I live in a dehydrated environment, low humid, like here in Utah, I'm not going to drink enough water, my skin not ever feel dry. I have to do my intervention topically.
So, and
Okay.
for example, depending on the climate you're in and depending on the temperature, what you have to do is you have to have good barrier function, because barrier function helps to keep your skin from being affected by outside conditions. And let me give you an example. Let's say, you listeners, somebody out there has an 8-year-old. Does your 8-year-old come home from school and go, oh God, I'm tired today and I had such a bad day and it was so cold out and I need a moisturizer? Now, why is that? Why is it their skin behaves beautifully, whether it's snowing, whether it's sunny, whether it's humid? It's because they have barrier function and they have all of these hygroscopic substances in their skin. So as we age, we need to create that to some extent, but also when you resurface the skin, your barrier function improves dramatically.
Correct. Love that. Thanks for clearing that one up. Okay, this one. Ooh, I really want to dive into something that kicked off this whole idea and conversation. We had a call, and I get this in messages as well. And people request often, is your skincare, does it have toxins? Is it toxic? And that's kind of a thing in the internet. And I was like, well, first of all, and that leads so many directions. I'm like, first of all, qualify toxic. Because by asking that question, I think there's a lot of misinformation and toxic. So let's talk about, say, like, Jan, does your skincare have toxic ingredients, or does it have chemicals? Which I'll just say water is a chemical, but let's talk chemicals.
That's a really complex subject. And without knowing specifics, because some people think if something isn't organic, then it must be toxic. Now, so let me just kind of start there. So first of all, there is no true definition for organic. And the government has stepped in and they've come up with USDA seal to say it's organic. And that has to do with how the elements in the product are grown to be able to say whether or not they're organic. It has nothing to do with the manufacturing process. It has nothing to do with other things and binders and things that get put in there that could be toxic and how it's manufactured, and I could go on and on. Now, in terms of just general toxicity, so a number of years ago, when Great Britain joined the European Union, they then they adopted all the regulations of the European Union. And among those regulations had to do with very strict cosmetic regulations for being able to have whatever that was being produced in Europe, as well as what was being sent into Europe, what was being imported or exported to Europe. And so for a company to be able to have their products sold in the European Union, they had to go through extensive toxicity testing, and it had to be done by a third party, an independent third party in the UK. And I can't even tell you how grueling this was, because if you had 1/1,000,000th of 1% of something that was not allowed, and their regulations are much stricter than in the US, your product could not be sent in to the European Union. And so we went through the toxicity testing and we passed, and every one of our products have passed the toxicity testing. Now, beyond that, every country has a health ministry, which is like our FDA. Some countries have very different regulations. For example, there's a country where if I have vitamin D in a skincare product, which is a very good ingredient, they consider that to be a drug. I can't send it in unless I take the vitamin D out. And it's all over the map. But in terms of toxicity, many companies stopped selling in the European Union because they either couldn't afford or their products were unable to pass. And you could also, if your product doesn't pass, then of course to reformulate can be extremely expensive and go through stability and go through all the testing and everything. So I can just tell you that our products passed.
They're carried there, and that's yes. Great to know. There's such a difference between, we don't want products like homemade in a kitchen. Okay, thanks for explaining that one. there's one question popped up, but I think it leads to another that we see a bit of that's in these questions we have. Do any substances in skincare lose their efficacy when used together? So any specific type of products, because one I see a lot is you can't mix vitamin C and retinol, or I get a lot of people going, wait, I can use my vitamin C and retinol in the same like routine. So that's a specific one, but are there any products that would lose efficacy if you're using them together?
To cover the specific with vitamin C and retinol, the reason that some companies don't recommend using vitamin C and retinol at the same time, because the vitamin C they're referring to is ascorbic acid. Ascorbic acid, in order to be effective, has to be at a pH of 2.5 or lower. About 50% of the population reacts to that. So if it's very reactive and then you stick retinol over the top of it, you're asking for probably a lot of irritation. So they say use one in the morning and one at night. Now, in terms of our retinol and our vitamin C is a different pH. It's L-ascorbic acid 6-palmitate or ascorbopalmitate. And I could go into spend an hour on all the studies and everything to show that it's far more effective, and how it stimulates collagen, and on and on and on. But suffice it to say that they can be used at the same time. It can be used with glycolic, it can be used with retinol, it can be used all at the same time. Now, in general though, it's very popular in terms of marketing rhetoric for companies to say, oh, we have this product and it's got retinol in it, and it's got glycolic in it, it's got vitamin C in it, and it's got, all these different anti-aging ingredients, and you only need to use this one product, and so it's fast and it's efficient and all of that. You cannot put all of these ingredients in one product. Now, number one, if I'm formulating a product, I have 100% to work with. I don't have 110, I don't have 150. And so let's just say that my first ingredient is water. And the reason you see water at first on the ingredient listing, because at least 50% or more of your product is going to be water. You can't bake a cake without liquid. You have to solubilize it. So then I also have my binders, I have my stabilizing ingredients, I have spreading agents, and then I have my actives. And let's say that I need 12% of this ingredient, and I need 5% of this ingredient, and I need whatever percentage of another ingredient. Well, guess what? I just ran out of room. But that's okay, because they look great on the label, and I just put little tiny amounts in there, and somebody will buy it, and I'll charge even more for it, and they can just put it on the shelf with their other $600 in product that they don't use. Now, the second issue is that there are ingredients that are not compatible. They're okay putting them on top of each other, but they're not compatible to sit in the same formulation. For example, in order for glycolic to stimulate collagen and to have the effects, the multitude of benefits that we've seen in the medical studies with histological studies and biopsies, it has to be at a pH for home care right around 3.25. Well, guess what? Retinol needs to be around 5. Liposoluble C needs to be at 7. I could go on and on. So what we do with the skincare management system, we call it layered technology, because we separate out these technologies in a way in which it maintains the absolute highest efficacy, and you're able to use all these various topical agents on your face without having to worry about if you are not getting the efficacy.
Thank you for explaining that. I love hearing it that way, because there is a lot of mixing and it sounds great, but they do interact that way, which is why I love it. It's visibly clear when we show duality that these can't go together, but they're in dual chambers. So it's fine to have them on top of the skin together. It's not fine to put them in the same bottle together. So that's why.
And let me add one other thing. So let's just say that somebody in your audience decides, well, I'm going to go to and get a degree in chemistry because I want to make skincare products. So a degree in chemistry is a basic foundation. Some people who are chemists spend their entire life testing soil samples. Some people spend their entire lives testing whether something is going to be fireproof. I hired a chemist one time that made one thing in his entire life, in his whole chemistry career, it was sunscreen. So they may not have anything to do with skincare. So what happens if they get into skincare, it's like an apprenticeship, because they're learning something that they only covered roughly in getting a degree. And so when they actually start working in this field, it's all about stabilization. Are they making a product that's going to separate? It's all about whether or not it meets, you know, bacterial standards and all of that. It has nothing to do with whether or not it works. So if I say to a chemist, is this going to stimulate collagen? And they'll pull out whatever papers they have from the raw material manufacturer and say, well, here's what it's supposed to do.
Yeah.
So when you go to a third-party manufacturer and have a product made, oftentimes you're using just one of the stock formulas. So what I'm talking about is when we actually go through the process of formulation, we actually go through what I call proof of concept. We actually go do outside studies. And we've had 5 products that have actually been accepted and published in a peer-reviewed medical journal, the Journal of Drugs and Dermatology. So these are journals that usually only publish things on cancer and things like that. So you really want, these are, you know, skincare products are expensive.
Mm-hmm.
And you really want to be using something that has that efficacy and that you know, that you're not walking into that situation where there's 10 things against you before you even started using the product because of how it's formulated.
Yeah, and also it's that kind of data is more than just what we claim it will do and what we, you know, you don't have to take our word for it. There's both science behind it and then your experience behind it. So like as far as the user's experience to see that it works, but the studies, that those things mean a lot to me. Let's talk, I'll quickly mention this one. This might just be a quick answer. Would you recommend dermaplaning before or after using an enzyme? I don't know if you have any thoughts on dermaplaning, Jan, but I say that's why we talk about SkinZyme a lot. SkinZyme is the enzyme, and I enzyme before dermaplaning and then days after. And if you want to add anything, I just wanted to address that one because the point is with the enzyme, we're not peeling deeper. So I don't use my acids right after dermaplaning, but enzymes are safe there.
Well, you know, CleanZyme and SkinZyme are,
I did them this morning, Jan.
I can tell, are called proteolytic enzymes. And proteolytic enzymes are enzymes that only digest dead or diseased tissue. They can't hurt normal living tissue. So let's say, for example, you're using a scrub. Well, even if you have the very finest polished granules, you can create microscopic tears in the skin. And how do I know what your pressure is or whether you're doing it for 1 minute or a half a minute? And it doesn't know the difference between the live skin and the dead skin. So it creates inflammation. So CleanZyme and SkinZyme are instant gratification. And they're so unique that our docs actually use them 2, 3, 4 days out after Fraxel, laser resurfacing, when the skin is not healed yet, but it's starting to get kind of peely and has a sort of crusty looking. And what they do is they use this and it digests all the dead and diseased tissue. It doesn't hurt the normal living tissue, the skin that's still kind of raw. And your skin just looks glassy. It's instant gratification. And so you use it with dermaplaning. People use it at home. It's one of my favorite products. It's how you get that really nice, glassy, glowy look. And it also helps if somebody is trying to address acne, if they're trying to just address discoloration, you know, large pores, fine lines, wrinkles, all those common skin concerns. Resurfacing, that's what I put that in the category of resurfacing. Now, resurfacing is really important. And I don't know if this is going to get to one of the other things you're going to say, but just really quickly. So people always say, you know, if you use glycolic and you use retinols and you do peels and you do all these other things, you're going to thin your skin. And I have a sarcastic answer. I say, I hope so. Because here's what happens as we age. The stratum corneum, that dead layer, the one that I told you should lay like shingles on a roof and look really vibrant and clear and radiant, it gets thicker as we age. And we start to see larger pores and we see fine lines and wrinkles, and it just doesn't look as vibrant, as radiant. Now, our dermis, on the other hand, which is 80% collagen, it thins as we get older. So it starts thinning, particularly in your 20s, about 1% per year. But if you have sun exposure and you do things and diet and all these other things, you can get more thinning. By the time you're in your 60s, you can have lost this 60, 70% of your dermis. That doesn't look good. So what we want to do is we want to thin and compact that stratum corneum, really thin, like a baby skin. We want to thicken the dermis. And these topical kinds of services, but also these topical agents, that's exactly what we're aiming at.
Mm-hmm.
And I will tell you, among two of the things that we're talking about, and we could, again, spend hours going into some of these topicals, but the two that have been studied more than any cosmetic ingredient in the world, more than any.
Yeah.
And I'm talking about histological studies, biopsies, whole medical conferences. The two are glycolic and retinoids. And the work that's been done on psoriasis, the work that's been done on ichthyosis, the work that's been done on aging, acne scarring, changing instructions coming from your DNA. I could go on and on. So these are things that can just really make this huge difference in how we perceive aging.
Yeah, I love that we're going to talk about, so glycolic and retinoids, I think there's a little bit of misperception around them. So there's two questions here. So we're going to keep going with that because someone asked, what products were we talking about? Cleanzyme, SkinZyme. So Cleanzyme is the cleanser that goes along with SkinZyme.
Right.
So we both have the proteolytic enzymes there. So then the next question was, so you were touching on this, Jan, but what do you think about over-exfoliating using acids at home? So that question, I'm kind of going, okay, so at home, yes, I definitely want you to use acids at home. It's going to be different from getting a chemical peel, but that kind of comes up a lot. We've talked about this before, but what about, how do we know the line between sufficient exfoliation, so we have that compact type epidermis, and over exfoliation?
Well, you know, with anything, you can overdo it. And I always say too, the things that you can have the best product in the world and somebody can be allergic to it. So there, you know, you can overdo it, and different skins and different weather conditions and all of that. But in general, everybody, I do a lot of consultations with physicians, a lot of consultations with very famous people, celebrities. A lot of it I'm under non-disclosure. I always say I can talk about one of them, that share, but everybody, doesn't matter who they are. They start off on the system. Okay. And the system is really kind of the perfect amount of, let's say, resurfacing, as well as it helps to address acne, and it helps to address the appearance of rosacea and fine lines and wrinkles and discoloration and all that. It's the perfect amount of resurfacing. But we always want to have things that can accelerate the system, can address specific skin concerns, acne and things like that. And we also want products that can further thin and compact that stratum corneum. So you get to that point, and everybody knows it. They get to the point where their friends tell them, what have you done? God, your skin looks amazing. Your husband tells you your skin looks amazing. Somebody I just did recently who works for a very large corporation, her significant other lives out of state, and they had been apart for about a month. He met her at the airport and said, oh my God, what have you done? You look 10 years younger. So you know that point where your skin is in its sweet spot. And typically to get there, it's a system, and it's things like duality for acne, or luminate for discoloration, et cetera, et cetera. There's things for rosacea, et cetera. But then there's also that additional resurfacing, Cleanzyme, SkinZyme, our Marini exfoliating pads, which come in a jar, and it's 30 pre-moistened pads with 4 different types of acid that works at different levels. Yeah, everybody loves that. And you just wipe it on your skin after you wash your skin, leave it on for 10 or 15 minutes, rinse it off, and put the rest of your products on. Instant gratification. These are also things that actually help various skin concerns to progress, to resolve them more rapidly. So if you have acne, it clears up more rapidly. If you have discoloration, your skin starts looking more even more rapidly, et cetera, et cetera, et cetera.
Love that. Okay, so I want to go back to some of the myths, which first I'm going to touch, I remember who said it. You mentioned that 5 products went through those like peer-reviewed medical journals. I think I know them, so Jen, correct me if I'm wrong. We have Luminant Lotion, Regeneration Booster, Duality. Ooh, I don't know if Siesta Serum's there, and I don't know
Siesta
the other
Serum,
one.
yes. Siesta
Okay.
Serum.
What am I missing?
You're better than me. I'm trying to remember what the fifth one is. And there's actually a sixth one that's been accepted, but we just haven't finished the finite writing part of it. And that is Rosa leaf.
Oh, yeah.
Uh-huh.
Excellent. Okay, so we answered that one. On these myths, I want to talk about oil cleansing. So I hear a lot to people, and it's kind of a remedy for dry skin, that we should definitely oil cleanse to leave the moisture intact. And I have some people say, like, I don't wash my face in the morning because I feel like it gets drier if I do wash it and I feel more moisturized. I could go on why I have a few issues with that, but I won't. So the idea of the oil cleansing is necessary, and it's better for the face, especially for moisturization.
So first of all, I'll tell you a quick story. I worked with a dermatologist in Southern California, very well-known derm. She's been on the Dr. Oz show. She's been on the Today Show television. She's really famous. And she wanted me to do her consultation. And so I said, so doctor, I went through what her concerns were. And then I said, so tell me, what do you wash with in the morning? Oh, I don't wash, just water, washcloth, because, all these cleansers make my skin dry. Okay. Mm-hmm. So anyway, after having a discussion with her and after getting her to use the system and the bioglycolic facial cleanser, she was astounded at how soft and moist her skin was. One of the reasons that our skin feels tight and dry is because, again, you have these cells on the surface, right? They lay like shingles on a roof, and you actually shed about 500 million cells a day all over your body. They're microscopic. But what happens as we age, I said they get thicker, but they harden and they cornify. And it makes your skin feel dry. And it makes it feel tight. And when we put moisturizers and oils on, we're wetting it down, we're making it feel more relaxed, but we're not addressing the issue. So that's one issue. Oil isn't going to give you more glycosaminoglycans. It's not going to increase your moisture. Now, it can be a barrier to keep water from escaping. Second thing about cleansing, you can use the best cleanser in the world, micellar water, oil, whatever you think it is, and it can't get into your follicle. The molecular size is too large. A glycolic cleanser, and not all glycolic cleansers are alike, so it has to do with surfactants and all kinds of pH and all kinds of things, but glycolic can get into your follicle. So not only does it dissolve and dislodge the glue-like substance or cellular cement between cells to cause that increased corneocyte cohesion to lift apart, but in the follicle, it interrupts the acne process because the acne process starts when cells abnormally stick together. And when we get rid of retentive material in the follicle, guess what? Your follicles look smaller. And also, you have fewer breakouts, etc. So cleansing done appropriately is not just about removing something superficial, because you wake up in the morning and it's not like you were playing out in the mud all night. Your face went out and had a party. Right. But it's really about that you want to constantly resurface that stratum corneum, and also all those things that are going on in your follicle that lead to acne. And again, we could really get into this in a lot of depth.
I love that. I know we could. It's like all of these could be a whole thing of their own. So when you mentioned glycolic getting in the follicle, so kind of by clearing the follicle, we minimize the pores. So someone asked about reversing, or can we actually make the pores smaller? You're not going to shrink the pores, but how are we best minimizing our pores? What ingredients or practices are most minimizing?
There's two ways. There's two things that have an effect on the follicle size. And follicles are not trap doors. They don't open and close. We steam the skin and we say, oh, we're opening our follicles. That's not really correct. Okay, so one thing is collagen. Now, collagen forms a very rigid structure around your pores. So when you're really young and you have loss of collagen, I mean, how many babies do you see with large pores? How many 8-year-olds? Right. How many 10-year-olds? Okay, so what happens is it forms a rigid structure. It's like Spanx. Okay, it keeps everything nice and tight. Now, as your collagen begins to break down, your Spanx get flabby. You don't have the rigid structure. So that's one reason why, even if somebody doesn't have a tendency to acne, as they age, their follicles don't look as refined. Second thing is that when you have retentive material in your follicles, you have clogged follicles, you have blackheads, and you may not be aware, you may not necessarily be breaking out, but very mild form of acne. When we clear away that retentive material, your follicle relaxes. So what we do is we want to stimulate collagen. We want a nice, thick, robust dermis, okay? Give that nice, tight Spanx back. And then we want to get rid of the follicular material. And what happens is the follicle relaxes, but it also has a much better rigid structure. And again, I wish you guys could be here in person and see my skin, but literally you don't see follicles. And I had them. No. And I'm going to be 69 in December. No. So I have a vested interest in these technologies that really do have an effect on the skin.
Yes. Okay. I love this. I'm balancing all the things coming in, and I love how you're answering that. Okay. Ooh, there's so much. I'm trying to watch time. We'll hit a couple quick ones that came in the feed. Oily skin moisturizer. Okay, and I'm gonna like turn that to a question. So they're asking, what would be an oily skin moisturizer? Because they use Hyla, they use siesta oil control, and I think Marini physical protectant. So what's an oily skin moisturizer? Now tell me if I'm wrong, Jan, but I tend to use a ton of serums and then my SPF, like the Marini physical. But we could say, does an oily skin need to be moisturized? Because that's when I see out there, if oily skin doesn't need moisturizer.
Okay, so first of all, I always define oily, because I say to somebody, if they say have oily skin, I say, are you oily all over? Do you look like a headlight at the end of the day? Are you really, really oily? So that's oily skin. Now, if somebody is combination, they might be quite oily in their T-zone. Sometimes I'll say, well, so your combination, well, how oily are you? Do you have to blot a lot during the day? Well, no. Do you just look a little oily at the end of the day? Well, that's actually, you know, almost going into normal. So what we're doing is we're not necessarily talking about whether or not your skin is oily, dry combination. We want to use products that are compatible with not making you feel more oily. But what it's really about, and this is a question that I ask every single person, again, I don't care if it's a physician or if it's Cher. First question I ask, if there was something you could change or improve about your skin, what would it be? Now, when you address these other concerns, I guarantee you that your skin is going to transform. People always say, well, you know, I want to glow. I just don't want to look shiny.
Yeah.
I want to look radiant. I don't want to look oily. So we can turn it into that. And as you address these various concerns, so somebody might say, well, my you know, the first thing they might tell me is, well, I break out. Okay, what else would you like to change or improve? Well, I have discoloration. I have some brown discoloration. What else? Well, I have dark circles. What else? Well, I have large pores. So think how you'd feel about your skin if we're able to address every one of those issues. And I guarantee you along the way, the oil isn't going to be the primary factor.
Right.
And so, you know, we have a system for normal combination skin and system for oily skin, et cetera, et cetera. And there are products but virtually every one of these technologies can be used on any skin type. It's just a matter of, do you want it to be more emollient? Do you want it to be less emollient?
Yeah. So more of a feel than what the skin needs. Yeah. That's why I like the feel. For those who don't know, I mean, we have a transformation serum as opposed to transformation cream. Right. So there's oil control in some things. So I feel like we have a lot of, that's where we can customize. We have a lot of control over how you want the feel of your skin. And sometimes that's what it comes down to. I want to know how they want their skin to feel.
You want your skin to look balanced. And I'll tell you, sometimes people wear oily skin like a badge of honor, like, oh, I'm going to be younger longer because I have oily skin. Do you know that if you have oily skin and you're having inflammation, that you have more transepidermal moisture loss than a dry skin? So it's a really complex issue, but we want to address the entire list of concerns, and all of that gets taken into consideration along the way.
Yeah. I love that. That was one of the questions kind of about oils in the skin. Okay. I don't want to derail that though. Okay, let's talk about I want to make sure I'm giving a broad range of all these different questions and concerns here. Okay, well, this question someone had about getting rid of lines and wrinkles. I mean, what kind of fair expectation we have? So, whereas the myth kind of comes from that, okay, I hear certain eye creams can get rid of crow's feet here.
No. No.
I mean, the same thing where people say, well, my grandma used heavy Pond's cream and she doesn't have her skin
any lines and wrinkles.
So
yeah,
nice.
I know.
Yeah.
She
So
probably didn't sunbathe either. Okay.
Right.
So you have two types of lines and wrinkles. So lines and wrinkles that in general, which we might see fine lines and wrinkles or crepiness, and that's typically 99 or 95% of what we perceive as inevitable aging is sun exposure. Only 4% is what we call intrinsic. Okay. So that's one type of line and wrinkle. The other one is known as dynamic muscle movement. Now, if you lived in a cave and you never had any sun exposure, and you talk and you squint and you make expressions, you're going to have lines here, here, and here. That is a crease in the muscle. And so what happens when you have this crease in the muscle and you put the skin over the top, you see it as a line. And you can put all the expensive products on it that you want, and you might soften it a little bit, but you're not going to get rid of it. And I'm not saying to everybody go out and get Botox, but that's what Botox does. Is Botox disables certain muscles that are overworking. It doesn't disable all of them. And it doesn't make you look weird unless it's done by somebody who wants to make you look weird. And so what it does is it temporarily disables that, so that that crease in the muscle goes away. And I'm always very transparent and very careful to have realistic expectations. Okay. So, but the rest of it is fair game. And let me just tell you a little bit about people. You can stick moisturizers on your skin all day. You can do all these expensive creams and things. And this has got, some kind of a stem cell from rose hips or something. No. There are certain specific things we know. What happens is as you age, now think about this. Your genes are made up of DNA. Some of your genes are what we call expressive genes. So the DNA expresses messages. It's the only messages your body will listen to. You've been out in the sun, you have a sunburn. The messages tell it how to repair. You've done something to your collagen, like all the inflammation and everything. It tells it to produce collagen or not produce collagen. Only thing it listens to. So you're born and you've got this epigenome and you've got this perfect DNA that's like a beautiful CD, no scratches. Now you start to age from the day you're born. And over time, we get little tiny scratches on there and bigger scratches. And pretty soon, these instructions are compromised. We don't repair the same way. And I guarantee you don't repair the same way at 40 that you did at 20, whether it's a broken bone or whether it is lines and wrinkles and all of that. So to give you an example, retinoids, which are very underrated and very misunderstood, and I don't mean all retinoids, but I'm speaking specifically about the right percentage, right formulation, actually have been shown. This is medical data. This is over 40 years of data to correct your instructions coming from your DNA. So you can go to our corporate website. I'm sure you have photos, Lisa, in which we have actual individuals, and they're not photographed weird. The photographs where somebody's doing this and then they're doing this. And then but you can see in just a short period of time that the actual wrinkle is significantly lessened. The appearance of it changes dramatically. So when we're talking about these topical agents, I don't like to put anything in a product unless I know it's going to have a specific effect. Yeah. And there are things that we can do today that it really sounds like science fiction, but we are on the cusp of so much that we're going to be able to do. And we can do a lot right now. Yeah. I want to even point out in that the way you just described kind of how you formulate and do the products that's something
have to, we see products in so much of the genres, which is fine, like cleanse, moisturize, serums. This is not just use a serum, but everything in your line has a point, where I always describe like transformation cream, where that it's not just a moisturizer, which is an emollient on the surface. It's a vehicle for technology. And I would say that's true for all of the products, are a vehicle for some purpose. So it's technology, but it's a purpose to cause something, instead of just like, we just put it on our skin. Because I see a lot of stuff with, go ahead.
You make a really good point. Like transformation, you said it perfectly. Yes, is it a moisturizer? Yes, because you want some barrier function, but it's also a vehicle for technology. And to give you an example, one of them in there is TGF beta 1, transferrin growth factor beta 1, which Dr. Weedo of Jefferson, we were the first company in the world to premiere this, and Dr. Weedo of Jefferson University determined it stimulates a type of collagen you don't produce after the age of 30. That's why I use it, not because it looks good on a label. I have another patent in there that's my patent called thymosin beta 4. And that actually is another thing that's been shown to correct instructions coming from your DNA. So there's a reason that it's not just slapping a moisturizer on your skin. Yeah. And every single one of those products have something that's going to address various kinds of concerns. So yeah, thank you. That's a good point.
Excellent. Okay, we have someone asking about in their 20s, you know, because I always explain so often that, as you said before, sunscreen number one. And I would also point out where you said how Botox isn't going to do, there's certain things Botox would have to do, but you also have to have your skincare, and therefore sunscreen. Botox isn't going to de-age the skin that way. But if someone's in their 20s, and so they're saying, besides, other than cleanser, siesta, and sunscreen, where would the priority be for their skin? If we're talking about, they're in a preventative stage, which is really lucky.
So first of all, most of the damage you're going to see in your lifetime happened before the age of 10. And at least 50% is programmed to your skin by the age of 20. So it takes 10, 20, 30 years to show up. So you look in the mirror at 20 years old and you think, oh, my skin looks pretty darn good. And it even looks really good at 25. When you start to see changes at 30, 35, 40, that was already programmed into your skin. Everyone should be using a retinoid. You want to change those instructions. Those instructions are bad. Your skin, when you start seeing those changes and you look in the mirror and you say, yeah, but you know, everybody gets older and it's just inevitable. No, it's not inevitable.
Okay, so would you want to explain why I ask people at least by 30 that they should be using retinol? When I say like we're working up to every day, they're like, what? Because we got two ideas here. I think two myths. One, it's for when we're older, like mature ages. And two, they're like, but I hear it thins the skin. This will probably have to be our final.
Yeah. Okay. Good. I hope it thins the skin. So what retinoids do, retinoids actually thin and compact the stratum corneum. Okay. You want that real thin, compact stratum corneum? They actually can grow new miniature blood vessels, micro blood vessels near the surface, not the bad kind for rosacea, but that gives the skin that great glow and that beautiful radiance. And retinoids thicken your dermis up to twice as much. They're the gold standard for anti-aging. They're the gold standard for acne. Not only that, but they have a tremendous effect on helping with discoloration. They've been shown to correct instructions coming from your DNA. We could spend an hour on retinoids. And when you put them in combination with certain other things, it accelerates them even further. There's medical studies that show using glycolic and retinoids together, they potentiate each other. They're very similar in some ways, but they're also different. So, you know, I can just tell you beyond a doubt that most people don't realize how much they can transform their skin.
Yeah, I get very passionate about that. And I think that's what most people get a little bit scared, because I'm like, you've got to have a retinol. So we can't overemphasize it. So
the battle
cry.
We
have like minutes here. I always feel like we have to end so abruptly. So is there any other points you want to make, or how we kind of end this today, so that I'm not like, oh my gosh, that was so good, we always run out of time, because that's always what happens.
Well, first of all, I think we need to have another session on talking about aging and diet and nutrition and all of that, because I think your audience would really love to hear about that. And it is, I mean, let me tell you, it's really fascinating. But again, if I can just really offer one piece of advice, it's that you really want to focus on what your concerns are and use technologies that are actually able to address those concerns and make a huge difference, a noticeable difference. So I just want everybody to know that it's such a pleasure to for Lisa to invite me on all the time, and I love doing this, and I know I wouldn't be here today if it weren't for you guys.
Pleasure is all mine and ours, Jan. Thank you so much. It's just always an explosion of good explanation and gets us all excited. I mean, I love, because everyone who's on here, you guys are awesome, because you're here for the skin chat. You're here to talk and understand skin. And as I always say, then we appreciate how our products work better when we understand the science behind it. So thank you so much, Jan, for sharing all of that. Love you guys so much. Thank you so much.